So, hi everyone. So, we are the group reporter for postpartum hemorrhage. So, I will be the first reporter. So, let's proceed to the discussion. So, what will be the learning outcomes for this discussion? So, at the end of the discussion, the learners will be able to describe the postpartum hemorrhage, identify the signs and symptoms of PPH, explain why it is rare but serious condition, state the prevention and the nursing responsibilities. Then lastly, we have distinguished the different types of PPH and its cases.
So, good day everyone. So, my name is Joran S. Chonko. So, I'm the one to report the introduction and the definition of postpartum hemorrhage. Any woman who gives birth can have a postpartum hemorrhage which may threaten her life. Postpartum hemorrhage is one of the leading causes of maternal mortality and an important cause of serious morbidity in the developing and developed world. The Philippines is still among the countries with high maternal death. In 2010, 298 deaths per 1,000 live births were registered in the country. Of these deaths, 17.3% were reportedly associated with postpartum hemorrhage. So what is postpartum hemorrhage? Postpartum hemorrhage is also called PPH, is significant loss of blood after giving birth, and it's the number one reason for maternal morbidity and maternal death around the world. Specifically, it defines as losing more blood than 500 ml of blood after vaginally delivery or more 1000 ml after the cesarean section delivery. It usually happens within 1 day of giving birth, but it can happen up to 12 days after having a baby. Losing a lot of blood quickly can cause a severe drop in your blood pressure. It may lead to shock and death if not treated. So, postpartum hemorrhage is excessive bleeding or heavily bleeding after the birth of the baby. So, normalize man yun ng mo-bleed si mommy kung mag-give birth siya kay baby. But, it's not normal kung too much blood ang mawala sa iya ha. So, losing a lot of blood can cause threat for their lives or the bundle lives. So, there are two types of postpartum hemorrhage. The early postpartum hemorrhage and the late postpartum hemorrhage. So, the early postpartum hemorrhage is a bleeding that occurs in the first 24 hours after delivery. So, it occurred 24 hours. The first 24 hours, I mean. So, there are two types of early postpartum hemorrhage. The first one is the uterine atony and the second one is the laceration. So, uterine atony or uterine tone, so refers to the soft and weak uterus after delivery. This is when the uterus muscle don't contract enough to calm that placental blood vessels shut. This leads to the steady loss of blood after delivery. So the second one is the laceration or the uterine trauma. So trauma that to your vagina, cervix, uterus, or perineum area between your genital and anus causes bleeding. So using instruments like forceps or vacuum extraction during delivery can increase your risk of uterine trauma. Sometimes a hematoma, collection of blood, can form in a concealed area and cause bleeding hours or a day after delivery. So the second one is late postpartum hemorrhage. It's characterized as bleeding that occurs 24 hours to 12 weeks postpartum, so more than 24 hours of bleeding. So there are two types of late postpartum hemorrhage: the restrained placental fragment and the subinvolution. So restrained placental fragment, this is when your entire placenta don't separate from your uterine wall. It's usually caused by the condition of the placenta that affects your uterus ability to contract after delivery. So the next is subinvolution. This occurs when the uterus is not completely contracted and retracted when will lead to the postpartum hemorrhage. So subinvolution slower down expected return of the uterus to its non-pregnancy size.
Uterine atony. So first is we have prolonged labor, very rapid labor, over distension of the uterus, or the excessive enlargement of the uterus. We have the use of oxytocin or the pitocin, or the other drugs or general anesthesia during labor. Then we have induced labor. So you may be at risk of anatomy of the uterus if you are delivering multiples such as twins or triplets. Your baby is much larger than the average, which is called the fetal macrosomia. Then you are 35 years older, and then you are obese, you have too much amniotic fluid, which is called the polyhydramnios. Then you have many prior births. And then next is, let's identify the etiology or the risk factors for the uterine atony. So first is the uterine overdistension secondary to hydramnios. So we have multiple gestation, use of oxytocin, fetal macrosomia, high parity, rapid or prolonged labor, intraamniotic infection, and use of uterine relaxing agents. What are the signs and symptoms of uterine atony? So we have excessive and uncontrolled bleeding following the birth of the baby. We have decreased blood pressure, an increased heart rate, pain, and a backache. So what will be the laboratory or the diagnostic exam? So estimate the blood loss by counting the number of saturated pads or by weighing the sponge used to absorb the blood. The treatment, we have massage, bimanual uterine massage, compression between a hand on the abdomen and the other hand will be in the vagina. So in the treatment, we include breastfeeding. So breastfeeding, it protects against all allergies, sickness, and obesity. It also protects against diseases like diabetes and cancer. It is easy digested, no constipation, diarrhea, or upset in the stomach. And also babies have healthier weights as they grow. Breastfeed babies score higher on the IQ test. So we have an example of bimanual uterine massage. So bimanual uterine massage, it reduces blood loss and to prevent PPH after vaginal delivery. And also, bimanual uterine massage is the technique used to cause to the uterus to contract, which treats atony and assists with expulsion of retained placental or clots. So we also include the breastfeeding position and the attachment. So we have 5 different types or the 5 different positions for the breastfeed. So first is the cradle using a nursing pillow for the support. We have cradle position. We have land back position. Fourth one will be side lying position. And then lastly, we have football or the clutch position. And then let's proceed for the attachment. So for the good attachment, we have wide open mouth, chin touching breast, lips turned outwards. And then for the poor attachment, we have mouth around nipple, chin not touch the breast, and then lips turn inward. And then let's proceed to the medication for uterine atony. So we have oxytocin, metergine, prostaglandins such as hemabate, ergot, alkaloids, and then we have misoprostol. For the surgery, we have to tie off blood vessels. So what will be the prevention for the uterine atony? So first, like the healthcare personnel must remind the patient to first take prenatal vitamins including iron supplements. Second one, exercise daily. Third, maintain a healthy weight. Fourth, we have a good nutrition. Fifth, drink plenty of liquids such as water. And then the following one will be avoid drinking caffeine or tea. Lastly, get screened for anemia to prevent postpartum hemorrhage. So what will be the AMDNA responsibilities? So checking of vital signs such as blood and heart rate. Then we have providing comfort and support to the patient, massage the uterus if ordered, check visible vaginal bleeding, then report for any changes, then perform perineal care if ordered by the doctor, and then position the patient comfortable after doing the perineal care, and then monitor the input and output of the patient every 4 hours. So that will be all about the uterine atony. So let's proceed to the retained placental fragments.
Good day, I am Hannah G. Villanueva, and today I will be reporting about the retained placental fragments. So, what is the cause of retained placental fragments? It is said here that if your contractions aren't strong enough to expel it, or if the cervix of the mother closes and traps the placenta inside your uterus or inside the mother's uterus. The etiology or risk factors of these retained placental fragments are multiparity, it priors to deliveries. Next is induced labor, excessive blood loss, previous history of retained placenta. Next is the PTL, small placenta weight, and history of dilation and cartilage, and history of cesarean delivery. Next is the sign and symptoms of retained placental fragments. So, the first one is fever. The second one is a bad smelling discharge from the vagina. The next is heavy bleeding. Second to the last is the large pieces of tissue coming out of the vagina. And the last one is pain. To identify the diagnostic or the diagnosis for this retained placenta fragments, the laboratory or diagnostic exam can be CBC, blood typing, and antibody screening test. So, how to treat or manage retained placental fragments? So, the first one is the manual intrauterine exploration. Next is the care must be taken to avoid uterine perforation, placenta, accrete, increate, or percept should be suspected. And then, treatment usually requires hysterectomy for this abnormal presentation. Conservative surgical management with manual removal and packing can be attempted also. And the last one is maternal morbidity and mortality are high if surgical therapy is necessary. Next is the medication. The medication for these retained placental fragments is that antibiotic prophylaxis, which includes gentamicin, ampicillin, and clindamycin. For surgery, it can be hysteroscopic removal. So, next is the prevention. Healthcare personnel must do the following. So, we must ask the patient to start breastfeeding the baby as soon as possible after the patient gives birth to help the contraction of uterus. And then next is tell the patient, or we must tell the mother to change position, like to roll to the side or to squat. So what are the AMDNA responsibilities? The AMDNA responsibilities are the following. So we must check the vital signs, then get medications from the pharmacy if it is ordered from the doctor, and then if need blood transfusion, let us ask the patient's family and then get it from the laboratory if it is ordered from the doctor. And then monitor the input and output of the patient every 4 hours. And then let us perform perennial care to avoid infection. And lastly, assist the patient in changing the position. So that is the retained placental fragments.
So this is Miss Ventalera Rosme, and I will be discussing about the uterine rupture. So what causes uterine rupture? So we have your uterus stretching too far, often because of carrying a large baby or more than one baby. Then we have external or internal fetal version, where your doctor positions your fetus by hand for easy delivery. Then previous perforation due to organ removal. Then many pregnancies resulting in decreased uterine function. And then we have excessive contractions that may damage your uterus. And then lastly, use of prostaglandins during a vaginal delivery following a previous cesarean section. Then we have etiology or risk factors for uterine rupture. So we have labor induction, labor augmentation with oxytocin, having had more than 3 children, and overly distended uterus from too much amniotic fluid or carrying multiple or a big baby, advancing maternal age, and lastly, a prolonged labor. Then for the signs and symptoms, excessive vaginal bleeding, sudden pain between contractions, contractions that become slower or less intense, abnormal abdominal pain or soreness, recession of the baby's head into the birth canal, bulging under the pubic bone, sudden pain in the site of previous uterine scar, loss of uterine muscle tone, rapid heart rate, low blood pressure and shock in the mother, abdominal heart rate in the baby, and then lastly, failure of labor to progress naturally. So what will be the laboratory test? So we have the CBC test, PCV test, and then for the treatment, intravascular volume and blood replacement immediate laparotomy. Then we have spontaneous rupture. 85% of patients require hysterectomy, whereas 65% of rupture scars can be repaired. Eat nutritious meals and drink plenty of fluids and take iron. For medication, we have ferrous sulfate. And then for the surgery, it is very important to have surgery because it's usually required to pull the baby from the mother's body. And then for the prevention of uterine rupture, healthcare personnel must do the following. So ask the patients about her medical history to be aware of any previous births, discuss with the patient about the options including what type of birth she wants to assess her decision for her and the baby. And then ask the patient to have regular check-up to monitor the baby and her health condition. So what will be the AMDNA responsibilities? So first is checking of vital signs. Second one, check visible vaginal bleeding. Then report if any changes, and then provide physical and emotional support, monitor the input and output of the patient every 4 hours, assist the patient in the changing position, and then lastly, perform perineal care and peri-light if ordered by the doctor. And then let's proceed to the genital tract trauma.
Good day everyone, this is Yasamidi Tuban, and my topic was all about genital tract trauma. What is genital tract trauma? The causes was blood loss, and etiology risk factors was nulliparity, large baby, perceptions, birth, operative delivery, and or episiotomy. Signs and this is are the signs and symptoms. First, bleeding, pain, bruising or swelling, and difficulty of urinating, maglisod og pangihi. Then laboratory and diagnostic tests, treatment management, full taken musicals repair beginning above the apex because bleeding vessels tend to retract. Continuous interlocking observable suture is generally used. When suturing in the proximity of urethra, insertion of catheter is advisable to avoid injury of this structure. Blood transfusion, antibiotics to prevent secondary infection. Then, treatment depends on the extent of the injury. It depende ra na ilang treatment depende ra unsa ka delikado ilang injury. Tub soak in a bath of warm water, over-the-counter pain medication, ice pack, estrogen cream applied to the vulva to help the skin heal. Pwede siya sa imong kanan og ice pack or mo-apply kag cream para makaayo sa imong makatabang sa imong vulva para maayo ang skin. Genital tract trauma. Para makapreventa ning genital tract trauma, healthcare personnel must remind the patient, we should remind the patient to maintain a healthy lifestyle, mukaog healthy foods and depends ilang gipang buhat. Quit smoking if the patient used to smoke. Kailangan mo undang og smoke. Then go to regular screenings. We should remind the patients nga always sila mo go sa ilang regular screening kung naunsa ba ilahong health. Increase consumption of calcium and magnesium. Practice good hygiene. We should have a practice good hygiene kaya importante ko na siya bisag wala ka aning sakita. Then this is our responsibilities. Responsibilities. First, we should check of the vital signs of our patient. Then check vaginal bleeding. Then report any. Then get medication from the pharmacy if naay doctor's ordered or nurse. Then position the patient in dorsal recubant. Then before doing the perineal care, perform perineal care or hot seats to avoid infection. We should clean the vulva of our patients. Then perform perilight for faster healing in the perineal care area. Monitor the input and output of the patient every 4 hours. We should monitor the unsa ilang gikaon or unsa ilang gipagawa sa ilang lawas.
So, diet. So, these are the foods that the mother should intake during her postpartum period. So, during the postpartum period, focus on the filling up on healthy sources of protein. So, protein is rich foods that are important to help you recover or to help the mother recover from childbirth and keep body strong and healthy. So, eat foods that have protein such as milk, cheese, yogurt, meat, fish, and beans. And the next is the fiber rich in carbs. Next is the fruits and vegetables. So fruits and vegetables have vitamins and minerals that keep the body of the mother healthy. They also have fibers which helps prevent constipation. And then fats like avocado and nuts and seeds. So some of the food that you need to avoid when you have postpartum hemorrhage. So the mother should not intake alcohol and caffeine, and some fish like shark and fish that is high in purines.
So let's proceed to the activity and exercises. So let's talk about the ovulation. So observing their health so that the adequate uterine ovulation occurs, promoting the descent of lochia and improving the functioning of the bladder and intestines, and also blood circulation, preventing thrombosis. It improves the blood flow, which in turn can speed up the process of wound healing. So let's proceed to the exercises. So exercise routine can safely include: first, we have pelvic tilt exercise to strengthen your abdominal muscles. Second one, we have the Kegel exercise to strengthen your pelvic floor muscles. Third, we have the belly breathing to help re-coordinate your breathing throughout your core. Fourth one, we have the happy baby pose to loosen tight pelvic floor muscles. Lastly, we have walking to improve your cardiovascular fitness and challenge your muscles. And then, here is our references. And then, thank you for listening about our topic.